Okay, great. Thank you all for joining us today. We are happy to have you with us. Before we start the panel discussion, we'll have short greetings. Mr. Roni Wolf, Tel Aviv consultant, I pass the mic to you.
Thank you, Lian. Good morning, all. Dear friends, dear colleagues. It's hopes that the next meeting will be somewhere physically, that we will gather together and let the Zoom meetings be proportional again. So welcome to the webinar on opportunities for Israeli healthcare startups in Hong Kong. I'm very happy and glad to have you here with us here today, and really excited to share this space with our distinguished guest speakers. As all of us know already, we have experienced throughout the last year and a half, we have seen global healthcare crisis, which has presented the commercial and healthcare industry around the world with challenges that we never seen before, especially in the modern time. From telemedicine to more efficient testing methods and devices, the technologies developed and utilized have gained a new meaning, new markets, and significant importance for investors. Still, when it comes to the Israeli startups, we understand the need, or the main need of our market for big markets. As it is, HKTDC will be holding a very important Asian Summit on Global Health on next November this year. And we will be counting with the presence of startups, investors, government authorities, and key players in the global healthcare industry. Of course, we will be happy to provide you more information and see you there, hopefully in Hong Kong. In general, the relationship between Hong Kong and Israeli is certainly a special one, and the field of healthcare indeed makes this bond stronger. As the gateway to Asia and mainland Asia, Hong Kong represents a strategic partner to enter the various markets in the region. As HKTDC Tel Aviv consultant, our main mission is to bring closer the activities and business ecosystem of Hong Kong to Israel. This is through trade fairs, conferences such as the AFF, the ALMC for Logistics and Maritime, and the Belt and Road Initiative. And of course, through our digital commerce platforms such as the HKTDC Sourcing platform. Hope you enjoy the webinar and looking forward to seeing your question in the Q&A session. Thank you so much, Lian. I will leave it to your capable hands from here.
Thank you, Roni. So let's say hi, or Li Ho. I hope I said it right, Li Ho, to our panelists in Hong Kong, Mr. Yoav Haimi, Commercial Consul, Head of Economic and Trade Mission at the Consul General of Israel in Hong Kong. Hi, Yoav.
Hello.
Mr. Andrew Pang, Managing Director at Ally Bridge, Hong Kong. Hi, Andrew.
Hi, everyone.
And Ms. Alice Tang, Assistant Principal Economist at HKTDC Research Department. Hi, Alice.
Hi. Hello, good day, everyone.
Say hi or shalom to our Israeli panelists, Mr. Viktor Ariel, CEO and co-founder of Sure Universal. Hi, Victor.
Hello. Pleasure to meet you all.
And Mr. Yoav Fisher, Head of Technological Innovation and Digital Health at HealthIL. Hi, Yoav.
Hi.
From the participant side, I can tell you, among the names I see on the right side of the screen, we have with us today Hong Kong investors and Israeli innovative startups in the field of AI, telemedicine, monitoring, human plasma, and many more. So let's start. We'll start with Yoav and Alice with a short background about the Hong Kong market. Yoav, let's start.
Okay, thank you, Lian. Good day, everyone. This is Alice from Hong Kong Trade Development Council Research Department. And today we are covering the topic of the healthcare industries in Hong Kong. So let's go back a bit in time. the pandemic, which has disrupted both economic and social activities worldwide, not only in Hong Kong, but everywhere. It has also brought the world's attention to the development on healthcare industries. Like in Hong Kong, the pandemic has speed up the development of healthcare innovation in different aspects, like including telemedicine, IoT applications in hospital, and digital health record management. So I will go through these three aspects a bit. So in Hong Kong, our first confirmed case of COVID-19 was in January 2020, which is last year. And then the government has announced that a series of measures such as social distancing and lockdown of building to contain the pandemic. So many patients have stayed away from hospital or clinics to avoid infections, even though they may have to seek medical treatment or to attend follow-up consultation in hospital. So consequently, telemedicine has become more popular as an alternative route to healthcare in Hong Kong. So owing to the COVID-19 outbreak, Hong Kong Public Hospital, which run by the Hong Kong government, have scaled back their specialist and outpatient clinic services. So they switched to physical consultation to telemedicine. Like for example, in Queen Elizabeth Hospital, they have launched the video consultation services to accommodate the patients in needs. So that's why last year, many people in Hong Kong actually have the chance or have to be forced to use telemedicine instead of physical consultations. So last year, 2020, there are actually two private telemedicine platforms launched in Hong Kong. One is called Dr. Now, and the other one is called Dr. Go. All the process, including video consultation and payments, are going through via the mobile app. And after the consultations, patient will receive their diagnostic result or even their medicines couriered to them at home within 2 to 5 hours in Hong Kong. So with these kind of convenience, it actually attracted so many people who work from home, or right now, even though we already resume normal working in the office, but telemedicine has already expanded their market in Hong Kong people. So mostly right now, their patients are mostly foreign expats and some very busy people, or even students, or those who are covered by medical insurance, all are keen on to do telemedicine because it's more time convenience, and you don't need to wait at the physical clinic or hospital to still have a chance to get infected in these high risk area. So telemedicine has been booming since last year in Hong Kong. So right now, the telemedicine mobile app in Hong Kong right now are usually treating for mild disease such as fever or cough or diarrhea, and some organizing regular follow-up consultation for chronic disease management such as heart disease or diabetes. So these are the latest trend on telemedicine in Hong Kong. So for the second aspect, is the development of IoT, Internet of Things application in hospital. While the world has entered the industry 4.0, but Hong Kong public hospital healthcare still remains at 2.0 era, which means more processes are still using pen and paper or carry out manually, physically by the nurses or the pharmacists, which has build up a very heavy workload on the system, and the healthcare workers are very overloaded, as we can foresee the aging populations in Hong Kong is booming as well. So there are quite a number of IoT companies in Hong Kong penetrating to the IoT healthcare. For example, one of the companies which used to focus on coaching logistic management and retail IoT applications, and actually this company has spun off its IoT applications to healthcare in public hospital. What are their services is they have helped the public hospital to manage their like pharmacists, for example, drug or vaccinations like management and stock counting. And they use like the IoT application to use like RFID to track like the medicine or the transplant organ, like where is the location and whether it is well controlled by temperature. So these are like actually help the public hospital to increase efficiency and accuracy on the drug management and like other aspects. And a point to note that like healthcare IoT actually can be classified into two main streams. One is clinical and the other is non-clinical. Like the IoT in Hong Kong right now for healthcare is mainly on the non-clinical one, which is mainly focused on managing like the drugs and the health record for the patients, but not really deep dive into the clinical. So this type of technological normally requires like approval for local medical authority for clinical technology. So that's why it's not being a big, many industry players in Hong Kong are going into this field. And last but not least is the digital health record management. And maybe you may be aware that like the first fully digitalized like smart hospital in Hong Kong, which is called Chinese University of Hong Kong Medical Center, had commenced service in this year, January, which is a non-profit, and this is a private teaching hospital wholly owned by the Chinese University in Hong Kong. And this hospital has introduced like IT concept in medical procedures and daily operations, such as like multi-dose dispensing system and like for outpatient record as well. So this paperless hospital is the first smart hospital in Hong Kong. And actually, like for digital health record management, not only hospital require that. Many like private sector, like clinical institutions in Hong Kong, which they have their own like outpatient or management record, they also require like a heavy like investment in digital health record management, because they usually have like the general GP practice and as well as like some referral cases to like professional doctors. So the patient health record can be automatically like transferred to the specialist instead of like the patient have to carry their own X-ray or their like a pile of record like to go to the specialist doctor. So this kind of digital health record management is really like on demand in Hong Kong, because like many of us are having like the chronic disease such as like heart disease or like diabetes or like stress management. Like that's why digital health record management is also like rising in the private healthcare sectors in Hong Kong. So this is the general overview we have observed in the past year, like since the pandemic. So I hope this will give everyone an overview of Hong Kong healthcare system development right now.
Thank you, Alice. Yoav, please elaborate some more from your side about the challenges and opportunities.
Yeah, I think Alice gave us a really good overview about the healthcare ecosystem in Hong Kong, but I will try to elaborate a little bit more. First of all, good morning if you're in Israel, and good afternoon to everyone in Hong Kong. And special thanks to the HKTDC team, and especially to Roni and Lian for arranging this important webinar. So my name is Yoav, and I'm the head of the Economic and Commercial Mission here in Hong Kong. So pleasure to meet you all here today. Just to give you a brief introduction about my role, so the main fields of activity of the Israel Economic Mission, which is under the Ministry of Economy and Industry in Israel, is including promotion of trade, attracting and encouraging investments to Israel, and creating strategic cooperation with Hong Kong companies, government entities, and organizations. When talking about Hong Kong, it is important to mention that Hong Kong is the world's freest economy. It's a global and cosmopolitan city with many similarities to the West in terms of culture, language, legal system, and so on. And Hong Kong is also a major hub in Asia and acts as a gateway and bridge to Asia in general and mainland China specifically. And the fact that Hong Kong combines East and West attracts companies and allow them to be exposed to the region. Hong Kong also invests many resources in developing innovation, entrepreneurship, collaboration, and R&D, as we can see in different government initiatives such as Cyberport and the Science and Technology Park. And when talking specifically about healthcare, Hong Kong is a highly developed and integrated medical system that uses modern technology and therefore is well-matched partner for Israel, which has similarity developed health system, as you will hear shortly. Also, the size of the countries is similar, and there is a lot of potential for cross-national development and testing new technologies. In terms of health parameters, Hong Kong ranks among one of the best in the globe, and that's thanks to early education, professional health services, and well-developed healthcare and medication system. And also, Hong Kong healthcare system is supported by a vigorous public sector, but also flourishing private sector. In terms of the public sector, it's obviously financed by the government, and the healthcare services are mainly delivered through the Department of Health and also the Hospital Authority. If you talk numbers, Hospital Authority managed 43 public hospitals with nearly 30,000 beds, and there are also 12 private hospitals with nearly 5,000 beds. It's quite many for such a small place. And currently, the public hospital account for about 90% of hospital medical services in Hong Kong. Hong Kong also has a well-established low-cost public healthcare system, which is quite similar to Israel. Citizens can enjoy very low-cost services at the public hospital, including general outpatient clinics, specialist outpatient clinics, and so on. But obviously, in general, the public hospitals in Hong Kong are often crowded with much longer waiting times. It's also something that's very similar to Israel. And on the other end, the private hospitals and healthcare center in Hong Kong provides high-end medical services and facilities, and also the cost is much higher than the public hospitals, but people are still willing to pay more in order to get better quality services and save the waiting time. Just talk briefly about trade barriers and regulation process. Hong Kong is a duty-free port. There is no barriers or limitation to the import of Israeli medical equipment, devices, and products. And also in terms of the regulation, medical devices with FDA and CE approval can be used in Hong Kong and Macau, and there is no local legislation that regulates the manufacturing or importing, exporting, and sale of medical devices in Hong Kong. So that's something that really important to emphasize, because it's different than China. They have the what we call Chinese FDA. That's from my side.
Thank you, Yoav. So now we have clear background about the situation in Hong Kong. Telemedicine, IoT, public and private. Yoav from HealthIL, can you connect the dots for us? This is the situation in Hong Kong. What happens in Israel, startup-wise?
Okay, so I'll go over this very briefly. Israel, as everyone I'm sure is recognized as one of the global leaders in the technological drivers behind healthcare innovation. And there's also very much a proven culture of innovation here. Another critical factor is that there's very critical density tech here and a very unique infrastructure in Israel to support the ideation of healthcare. Under the hood, there's a couple of factors.
We don't hear you so well. So
okay, I'll speak up.
Okay.
So under the hood, there's a couple of national initiatives for healthcare innovation. Israel Innovation Authority. There's national projects dealing with data lakes, etc. The healthcare organizations themselves here are very open. Innovation management as a profession has expanded greatly over the last 5 years, and there's dedicated headcount even in the smallest hospitals. Access is great here. There's an open door towards that. And there's also financial incentive to do initial alpha work with them. Industry is also very active here. There's always been an extensive presence of companies in healthcare. and Israel is more and more seen as kind of this local, maybe global innovation hub. All the pharma companies, well, most are here, the device companies, but also we're seeing a lot of movement of the major tech players that are expanding their healthcare footprint here in Israel. I work with Facebook and AWS, all the way through NVIDIA, Garmin, Salesforce, etc. There's also a lot of money, frankly. There's, some would say, even too much money. So there's lots of financial support for innovation across the board. But, and I think this is what's critical to understand, is that there's a couple of different things that need to be. The success of healthcare innovation isn't just about health, it's also about deeply understanding workflows, policy and regulation, and healthcare economics. And so the benefit of these types of meetings is to kind of overcome these two things that I see here on the ground, the knowledge gap. And the second is kind of an access gap. And knowledge gap, I mean, how are things in Hong Kong different, or in Southeast Asia in general, than what's going on in Israel? That knowledge gap about what systems don't exist. What EMRs are you using? The actual financial models of healthcare systems, where there's value add that can be given. Not just understanding here's an opportunity of going on, it's the knowledge that's much deeper. And the second aspect is the access. You know, there's always this big, wide ocean about who am I going to pick up the phone to on the other end who's interested and relevant, can be a decision maker. And that's why I think these types of meetings are very critical for overcoming both this knowledge and access. There's a lot of innovation here in Israel, but technology is not enough to succeed in healthcare innovation. Just one factor of multiple.
Thank you, Yoav. This is why we gathered here today. And guys, if you don't know Winky from Yoav's team, she's a great contact. We can send her details later, and you're always welcome to contact us. And we work closely with the HKTDC team in Hong Kong and about the conferences and fairs. So we are here for you. If you want to work more with the Hong Kong market, we'll be happy to assist you. So now moving on to investments. Andrew, we will be happy to hear, as a leading investor in Hong Kong that already invests in 2 Israeli companies, what our investors are looking for.
Hi, good afternoon, or everyone, or good morning to everyone. Yeah, just maybe as a quick introduction, about RLI-Bridge. We are a healthcare life science focused investment funds. We started in Hong Kong, and we also now have offices in the US as well. So our focus is really investing in global cutting edge technologies that solve real unmet medical needs. And our investments spread across everything from medical devices, biotech, digital health, tools and diagnostics. And we have a global mandate. Historically we've invested in China, US, Europe, and obviously in Israel as well, having made 2 investments so far in Israel. I think just to respond to Leanne's question, I think Israel has always been an interesting market for I guess any investors who are looking for really technologies, cutting edge technologies, lots of innovation happening in the region, and at the same time where, a lot of the innovators and startup companies are looking for exposure to outside of Israel, and I think that's where investors like ourselves could really play a meaningful part in helping bridge that gap between where we have the local knowledge and understanding of the various markets, from the China market to the US market and European market as well, and helping companies in Israel to think through how they could move to the next steps in their in the growth of the company.
could you please elaborate more on the specific investments that you already made in Itamar Medical and Marvik Dental Systems?
Yeah, sure. Yeah, absolutely. I think, you know, so both companies are medical devices companies that we've made. You know, one company is called Itamar, which is already listed in the US, you know, and you know, absolutely fantastic. The company is doing, have at home, you know, sleep apnea test device. It's been really commercializing, you know, in the US as well. Maverick is it's an investment that we've recently made as well. You know, it's got a you know, a really innovative whitening platform that, you know, allows sort of long-lasting, less invasive, less sensitivity whitening solutions for tooth whitening. And so, yeah, both companies, you know, we see, first of all, you know, the technology being truly differentiated. And it's, at the same time, you know, there's huge market opportunities, you know, first in the US and to a certain extent, you know, in China, Asia, you know, including Maverick, you know, who's already starting to, you know, find local partners in this part of the world. You know, and you know, we've obviously been helping the company on thinking through, you know, how they could, you know, bring their products over, you know, including the regulatory approval, including finding the right partners, etc. Yeah, so we are excited about these investments. Yes.
So Andre, it's a good time for you to hear what Dr. Viktor Ariel has to say about the collaboration of Sure Universal with PCCW Global and how they work with the Hong Kong market and also with Shenzhen. So Victor, please tell us about your IoT solutions and the company, and how did you reach Hong Kong?
Hello all, thank you. So we started in Hong Kong very early. We actually wound up getting an angel investor from Hong Kong about 5 years ago. And that's how we started. So we spent a lot of time in Hong Kong and in the general area of the Greater Bay Area in China as well. So our company is developing a remote patient monitoring platform based on IoT technology. We are device agnostic, so we can basically connect any device to the gateway, which is a smartphone and or tablet, and then the data is transferred to the cloud, and from the cloud to the patients and doctors. So clearly there is huge demand for something like that. I can tell you that the market size increased more than 10 times in the last year and a half market projections. And specifically in Hong Kong, there are several great initiatives like the Smart Hospital. The Hospital Authority in Hong Kong is pushing very hard for the paperless office solution. One point I would like to bring up is standardization. The paperless office and EMR systems in Hong Kong already switching to an international standard HL7 FHIR. By the way, in Israel as well. So our solution is, of course, based on that standard, so it's very critical. So doing business in Hong Kong is not difficult, but it's not simple either. So on the one hand, it's very easy to open an Israeli subsidiary in Hong Kong, no problem. On the other hand, if you want to open a bank account, wow, that can take a little bit of time. Certain procedures, you know, in Israel, we're used to doing things quickly. Certain procedures in Hong Kong are more regulated and take longer time. So, and you need to be prepared to that. And regarding our collaboration with PCCW, PCCW, of course, is one of the largest internet service providers in the world in infrastructure space. They are present in 130 countries. In addition, there is a Hong Kong branch, HKT, Hong Kong Telecom. So we work actually with both of them, and we started working with them early. Before the pandemic, we started working with them on integration of our IoT system with their IoT platform. And clearly for medical purposes, you need to run a pilot, so validation. So we did validation at the Hong Kong Smart Hospital, and it passed successfully. So now PCCW is setting up a website for recommendation of their partners worldwide. So we are lucky to be one of their partners, and we will be on that website shortly. The idea is that we're device agnostic, so we can take devices from any manufacturer, more or less, that use standard communication protocols like Bluetooth, Wi-Fi, or USB. And for example, in HKTDC catalog, there are more than 10,000 companies that work in that space. And a lot of them are, of course, China, Hong Kong based. So we work with some of the leading companies in the region, and it's very important to develop relations and relationships with the companies in the area. Just there is no substitute for the relationships. So that's something that you need to invest a lot of effort. The good news is that these relationships last for a long time. Even if you are faced with a rejection the first time, don't get discouraged. The long-term relationships, they can come back. So I think it's an opportunity that requires some work and understanding the cultural differences between the two places. Also, the great opportunity is, of course, Chinese initiatives of the Greater Bay Area. It's easy to get on a boat in Hong Kong, and now later you're in Shenzhen, across the bay. And in Shenzhen, we also work with a number of companies like Skyworth, the largest set-top box manufacturer in the world, on a government project for basically providing medical health care and remote patient monitoring, specifically for some of the collaborations between Hong Kong and China. So this is in a nutshell.
Thank you, Viktor. I think the main thing is to have the first connection, like you had the angel investor.
Very important, yes.
Yes, yes. So, and it's know how to reach to the right investor. You touched a bit the GBA, and this is something that I want us to speak now about, because Hong Kong is a good, I don't like the word gateway, but it's a good gateway for the Greater Bay Area. And Alice and Yoav, if you could please elaborate more on that, specifically the connection to China and to the GBA.
Yes, actually, if you have aware that the GBA outline plan has been out in 2019, and this is the plan from the mainland central government, which have designed the 9 mainland cities in Guangdong province and Hong Kong and Macau, 2 special administrative region, to collectively to grow together and have set a pilot scheme to have their industry to seek development and pathfinding. So for in healthcare and technology, actually, there are some innovative pilot scheme, like for example, in Hong Kong, those Hong Kong registered drugs and medical device, which is used in Hong Kong public hospital under Hong Kong government, actually can use in designated hospital in the 9 mainland cities. So this pilot scheme has been tested and ended like just in coming July 31st. And this was have an opportunity to see that like how mainland governments open their doors to Hong Kong registered drugs and medical device. So this is like a key path finding, like for Hong Kong, like how overseas companies can tap into the mainland market while Hong Kong, because for example, your medical device or your drugs has been used by the Hong Kong public hospital and endorsed by the Hong Kong Department of Health and Hospital Authority. So these kind of drugs and medical device can be used in cross-border in the GBA area. Right now, the Hong Kong University Shenzhen Hospital is one of the hospital which is carrying out this pilot scheme. And this, as I mentioned, this pilot scheme will be ended in July 31st, which is a few days later. So we will expect that the mainland government or the GBA community will evaluate the process or the effectiveness of this scheme. And we are looking forward to see whether this scheme will be extended or like expand into other areas in the mainland.
Nice. Yoav, do you have something to add?
Yes, I think, again, the main thing about the GBA is to get mainland China closer to Hong Kong. Eventually, Hong Kong, as we mentioned, is quite a small market. It's a good way to start with Hong Kong for different reasons I already talked about. But then when you talk about the bigger market, GBA have about 70 million people in total. And that's a way of like serving additional clients, of course, that have similarity in terms of needs. We didn't talk about one of the biggest problem in China and Hong Kong, which is the aging problem. So many people like elderly, of course, need solutions. And of course, in terms of the system, it costs a lot. So that's they have similar problems that Israeli companies can address. In addition, the collaboration between Hong Kong and the Greater Bay Area, I mainly talk about Shenzhen, that Hong Kong is really strong in the financial part, but Shenzhen is really strong in the industrial part. So that's another option for collaboration, also for Israeli companies.
Thank you, Yoav. So we mentioned China. We cannot not mention the USA. And Victor, this question is for you. Working with Hong Kong and China, do you still operate in Europe and the USA?
Yes, we actually have partnerships. Remember, we're a startup, so we don't have that much bandwidth to work with the whole world, but we try. So we have a partnership also with T-Mobile in the United States. And of course, that brings us to Europe as well. In addition, we are working in the Middle East with the Emirates, Dubai. Since the peace agreement, we signed an agreement with a company in Dubai, and now they're promoting us in the Arab world. And furthermore, we signed recently an agreement with Brazil, with an integrator in Brazil to promote our solution there as well. So we are trying to cover many areas, but Hong Kong is sort of like a second home to us. So we've been there the longest, we understand the culture the best. And I think this is also the greatest opportunity because of the whole Bay project there. So yeah, I greatly encourage Israeli companies to participate in that. And of course, needless to say, Hong Kong also has the best food in the world for anybody.
I agree.
Right, yeah.
Well, it's an important point because we know that some of the startups that work with Europe and the USA are a bit afraid to connect also to Asia. So it's good to know that you can work with both and you succeed in both. From startups to investors and investments, Andrew, we want to hear more about what do you think about what differentiate Israeli startups when working with Israelis. What is different? And also, we have some questions here from the innovative startups that joined us today. How can they reach you?
Sure, I'm a very reachable person. So I think you can feel free to just add me on LinkedIn. I think my profile is on LinkedIn. So feel free to reach me on LinkedIn. And so I think going back to your question, yeah, and it's a great question. I think one thing that always amazed me is how much innovations coming out of Israel, and I think that's and not just innovation. I think a lot of the entrepreneurs and innovators in Israel, they not just technically savvy, but also have really the mindset of running a global business. And I think that's important when you're trying to attract investors outside of Israel, because similar to Hong Kong, I think Israel, the market itself it's small, right? And so ultimately, for any investors, we are looking, when we put our investment money to an investment, we obviously are hoping that that investment, could grow as large as possible, and that inevitably involve going abroad and going outside of a single region, and so I think I think the important thing is, as for any startup, is not just to think about, the local market, but also think about, how and at what point, when is the right time really to reach out to other markets. And I think, that's where a good global investors will come in handy, right, to give that kind of advice. Because we've been there, we've done that. I personally have set up JVs, for European companies with Chinese companies, etc., and doing cross-border investments. So, I think that kind of insights and allowing a company, as Victor said, right, startups, you are always constrained by how much resources you have. And, thinking through where to allocate the resources correctly is, a big part of the game. So yeah, I think, love to work with, more and more Israeli companies going forward.
Yeah, and if I can elaborate as well.
Yes, of course.
You talk about the US, I think Show Medical is quite unique in a way. They started in Hong Kong, and typically Israeli companies will choose first the US market or the European market. But saying that, I feel that COVID changed the picture a little bit, and companies start to understand that you need to explore more and find other opportunities. And one of the companies was asking how they can approach Andrew. So I can say that my mission, and that's actually my job, to help Israeli startup and connect them to investors in Hong Kong, or to partners or distributors, or whatever they need. That's my job. So I can suggest any one of you here in the audience approach me, and I can promise you that we will do as much as we can to help you. And I think specifically when talking about healthcare, despite most of the industries are now facing lots of challenging area because of COVID, I think the healthcare system is the one who actually growing, and there are a lot of opportunities. Alice mentioned telemedicine, of course. That's something that investors and partners are really looking for those solutions. And I also think that the success of the vaccination process in Israel, even now we are facing a little bit the Delta variant, but Israel is still a big success story in terms of the vaccine. I mean, we managed to set the Israeli ecosystem as one of the leading one. and we get many requests from Hong Kong companies to work with Israeli companies, not only about COVID, but in general, because they suddenly understand, okay, there is something unique in Israel that we want to investigate more.
Thank you for adding, Yoav. We will send, I guess, an email to all participants with your email, WinQ's email, Andrew's LinkedIn, and of course, HKTDC Tel Aviv information, so they could reach out and start working with the Hong Kong market. Yoav Fisher from HealthIL. We heard what Andrew said about working with Israeli startups. Could you say from the other side, what do you think are the challenges and the strong points of the Israeli startups that are looking to work with Asian markets?
Okay, so there's a couple of things that need to be considered here. In general, I find that Israeli founders and also their financial backers sometimes ignore or overlook the opportunities of Southeast Asia. The general tendency is to go to the United States, which is, it's missed opportunities, both in Europe, both in Asia, in India, Latin America. And the reason is simple, right? Because most VCs and founders think they understand how to get money from healthcare in the United States. This goes back to my previous point where I think someone like Andrew can very much help, is to understand how to get money and access from Southeast Asia. And it comes back to that knowledge and that access gap. The natural tendency is to go to the United States. And, as someone who I don't know Southeast Asia as well as I do Europe, for example, or Latin America or the United States, I see a lot of opportunities. A lot of it's tied to regulation. A lot of it's tied to understanding how the system works. And this is where, unfortunately, there's a lot of things that can be done that are just typically overlooked.
Thank you, Yoav, for adding. I think we covered the tips before the Q&A, but if you have more tips to share with the startups, so please share your tips now, and then we'll move to the Q&A session.
Yeah, at the end, I would like to share some of my company interview in Hong Kong. For example, most of these are startup. For example, university graduate student, he has his own startup in Hong Kong and Science Technology Park, which is involved in R&D specification for eye treatment. The technology is too advanced that I don't want to get too deep into it, but I want to show this case as a demonstration how Hong Kong and the GBA can collaborate collectively to grow together, because in this case the graduate university student is from Hong Kong and University of Science Technology, and he have his own R&D research solutions for some kind of eye treatment. But in order to get this prototype to be manufactured and or get these prototype to be tested, he actually sent the idea to a Shenzhen office or the Shenzhen counterpart, his partner, to get this medical device to be produced. And because in Hong Kong we don't have a strong manufacturing base in Hong Kong, but just across the border, Shenzhen, we have a strong closely working supply chain, and manufacturing is very strong, as it is called the Silicon Valley in China. So that's why in Hong Kong we mainly focus on R&D or technology applications. But once it's come to commercializations, actually the Greater Bay Area, the mainland part, can help Hong Kong companies to put their dreams come true, because manufacturing is much cheaper and more efficient in China. So that's why here is the case for Hong Kong companies or even overseas companies in Hong Kong setting up their office to have their R&D development in Hong Kong and patent IP protections in Hong Kong. But for commercializations, they can use the cheaper labor costs across the border. So that's why in the healthcare innovation technology, you can have Hong Kong as your head office and like use the back end or the across the border mainland cities to have your prototype or commercialized products to be manufactured there.
That's a really good tip. Yoav,
maybe I can say a few words about the challenges for Israeli startups specifically working in Hong Kong and in Asia in general. I think in my experience, we're great at innovation in Israel and getting to a prototype and showing the technology. There is a difference, however, what we consider a product and what is considered a product in Hong Kong. And, listening to customer requirements rather than, demonstrating the great technological advantages is sometimes just as important. And in many cases, I think is very critical. Because some of the requirements may be different from the requirements in Israel. So you need to adapt your product to the local market. That's one. Also from the point of view of investment, there are different stages of investment. Sometimes it's easy to get seed investment. But then when you go to the market and you want to do, productization, as Alice said, it's a great place to do productization. But also getting to the product is a key from the point of view of investment, because the next step in investment, you have to have revenue, right? So it's sort of chicken and egg kind of situation that you need to solve first to get to a product that is suitable for the local market, and and then that would bring the investment in our experience, and that's a pretty big challenge.
Thank you, Victor. We have 5 minutes left, so we'll move to the Q&A session. First question we received. Do Hong Kong authorities helping to development and stability of new created startups, including medical startups? Alice, do you know of any funding?
Yeah, actually, Hong Kong government has got a funding I think it's around $2 million to attract overseas talents to set up their office or laboratories in Hong Kong. But this is a 5-year scheme, and which will be launched soon. So we will keep it monitored. And right now in Hong Kong, the Science and Technology Park, which offer rental space for startups and innovative industries. And of course, the space is very limited. But in the future, in long run, actually Hong Kong is building up the Lok Ma Chau Loop in between the border of Shenzhen and Hong Kong. So we don't worry about land, just come and then we can find you a space.
Yoav, do you have something to add from?
Yeah, it's quite similar to Alice. Hong Kong is really trying to develop the R&D process within Hong Kong. As you know, Israel is really good at the R&D process. And the initiative that the government took are two. One called Cyberport, and one is the Hong Kong Science and Technology Park. And as Alice mentioned, they're helping startups to find a place to set the office, which is much cheaper. As you know, real estate prices in Hong Kong are super high. So it's really helpful for the Israeli startups, at least at the beginning. And also helping them with finding relevant partners or relevant investors. Again, from my perspective, usually the best way to do it is first start the interaction in Hong Kong and find the relevant partners, and then obviously the next step after you see the relevancy of the market, you will open an office within Hong Kong. So that's the way it usually works. And also another thing about investors, at least from my experience, something I can share with you is that most of the investors are looking for pretty much mature companies. Mature means have some sort of existing product commercialized, and also, as Victor said, have initial revenues. They are more risk averse, again, from my perspective, And also another important thing, many investors will ask you, what is your Asian angle? Like, are you planning to expand to Asia? Are you planning to expand to China? That's something really important, because if all your interaction are within the US and you just come to Hong Kong for the money, I can tell you it's not going to be easy.
Thank you. I forgot to mention that we received this question from Shmuel Yerushalmi. So thank you, Shmuel, for sending the question. And next question is from Eyal Bartfeld. And the question is Hong Kong, we touched a little bit, but if you can tell us more, is Hong Kong medical system separate from mainland China? And our decisions, our policies set locally? And also, I think it's about the differentiation that we have to make between Hong Kong and the GBA, that Guangzhou is part of the GBA.
Actually, I can briefly describe the situation. Is like China has its own system and policy on medical and healthcare, and Hong Kong has our own system. So these are two different systems, but in GBA, we are both government, like Hong Kong government and Macau as well. And the mainland government are trying to set new regulations or policies just specifically between these 11 cities. So that's why GBA development is pilot testing, for the not only for healthcare, but for the region to this specific area to grow collectively. And if this kind of for example, financially, we have the Shenzhen and Stock Connect between Shenzhen and Hong Kong. So this kind of innovative measurements are actually the three governments are trying to collaborating.
Thank you, Alice. So unfortunately, it's already 11 o'clock in Israel, which means our 1 hour together is now finished. And we will be in touch. We'll have more webinars. We'll hold the ASGH, Asia Summit on Global Health in November. And we'll be happy to connect you to the investors and to decision makers there. And thank you for joining us. Thank you all the panelists. I think we are a bit smarter now. So see you next time.
Thank you so much. It was great to see you. Thank you, Lian. Thank you all. Alice, Victor, Yoav, Andrew.
Thank you.
Thank
Bye.
you. All the best.
Bye.